So these lecture objectives are what you can use to prepare for the lecture quiz. So we're going to talk about the first topic, Introduction to Anatomy and Chemistry of Life. So those are great little study questions to guide your thinking. So when a person takes a class in anatomy and physiology, they wonder, what's that about? Well, anatomy is looking at parts. So it's the structures that we're going to look at. And most of the anatomy that we can see with the naked eye is in the lab for our class, the lab portion of the class. So looking at organs, looking at slides in the microscope, anything that you can see as a structure that has a shape or a form, that's the anatomy part of the class. Physiology is looking at functions, so kind of think of the two being together. So processes in the body. For example, looking at blood sugar levels, analyzing blood pressure controls, how the body controls blood pressure, pH, temperature, all secreting of a protein, all those processes, that's the physiology part of the class. And which part do you think is harder for most students to understand and do well in? The physiology, yeah, because that's where the critical thinking comes in, because you not only have to know the parts, but you have to know what do those parts do. So the function part is the hard part. So if you're deciding, you're not feeling well and it's lab or lecture, which part do you think is going to require more attendance and attention of your time? The lecture part, right? So very, very important to not miss class and to always, watch the videos if that's, if you're taking it online or we're not having class because of weather or whatever. So the types of anatomy, gross or macroscopic, are things we can see with the naked eye. So if you're looking at the cadaver or a skeleton, that's gross anatomy. And then microscopic anatomy is looking at things with a microscope, obviously. Cyto means cell. A lot of our terms in science have a Latin or Greek prefix. Cyto means cell, so if we're looking at cells, the study of cellular structure and function is called cytology. And then histology is a study of tissues. And a person who spends a lot of time looking at tissues would be somebody who works in the lab, say at Gunderson, and their job is to look at cancerous tissue or deciding if something's cancerous. So looking at biopsies is the job of a histologist. They're looking at tissues, looking for abnormal cell growth in those tissues to determine if there's cancer or not. So when we look at physiology, again, it's study of function. So cellular physiology is what cells do. A nerve cell has a different function than a heart cell does, and a skin cell. So all those cells have different functions. Neurophysiology is focusing just on the brain because it's so intricate, so complex that there's classes just by themselves looking at how nerves and nerve cells function and neurons. So that's neurophysiology. Pathology is just abnormal function. So a pathologist is someone who studies disease. So disease processes, disease structures, and how they change. Like cancer, we know if you have thyroid cancer, there's going to be a lot of that hormone in your system that is not functioning properly because those cells are damaged and not doing their job. Prostate cancer, people have elevated levels of PSA in their blood because of those cells overproducing and maybe not producing the hormone correctly. Exercise physiology are the changes related to exercise. How does our heart and blood vessels and muscles, how do they function differently in the environment of exercise? So those are all physiological topics. So when we look at cellular functions, all cells have these things in common. They all work together to maintain life, but life would not exist if cells couldn't do these major life functions. So this list is something that you should know and be able to give an example of. So when we talk about maintaining boundaries, having a cell membrane is what maintains a boundary. It's what keeps things in the cell in and things outside the cell out. Our skin is a collective example of cells maintaining boundaries. We don't have electrolyte loss through our skin, right? And we don't take in water when we go swimming because of our skin. But if a person burns themselves and gets like a 3rd-degree burn, they lose that outer layer, that boundary, and they're subject to infection and electrolyte loss. Movement is being able to move materials through the body is important, as well as the body be able to move itself. We can move ourselves away from a hot fire, right? We can move ourselves toward, you know, a warmer environment when we get cold. So to be able, the ability to move and move materials is essential for life, because a plant can't move, right? But it's still alive because it can move materials. It can move water through the roots to the leaves and sugars from the leaves to the rest of the plant. Responsiveness, what system is most responsible for responding, do you think, of all the body systems you're already aware of? Yeah, the nervous system. Our senses help us respond to our environment and know when to act or react. So that's, you know, really important for life. If we don't respond to our environment, then environmental changes can cause death. Digestion, we have to be able to take in nutrients and break it into its bits to get energy from that. So if a person's digestive tract is not working, you know, they can't process food and they'll die quickly. So being able to digest nutrients and break them up into the little bits is important for life. And metabolism is just any chemical reaction in the body required to either break down or build something. So when you talk about your metabolism, you're breaking down nutrients to be used for energy, and some of those nutrients are used for building new cells, for building muscle, building new hormones, new enzymes that your body needs. So any chemical reaction in the body, building or breaking down, we describe as metabolism, and all cells metabolize or they die. Disposing of waste, part of metabolism is producing waste products that need to be whisked away, right, by the body. So we need to get rid of waste via urine, bowels, sweat, and our exhale. What's the major waste that we exhale? Yeah, carbon dioxide. So that's a byproduct of metabolism, very important. We get rid of that. Reproduction, we need more cells, right? We wouldn't be here if we didn't have reproduction from our parents, but also of our own individual cells, because you shed your skin about every 30 days, slowly, not like a snake where it's laying in the corner of your bedroom, right? So we get new cells, little by little by little, that over the course of a month, your skin, a month later, is completely different as far as cells, made up of new cells. And you replace your skeleton about every 10 years. But now this stuff slows down as we age, and we don't have that turnover as we age. But there's certain things you can do to increase the turnover, like, you know, using a washcloth on your skin, or doing a little sloughing off. Abrasion on the skin helps to turn over skin as we age. And we know that weight-bearing exercise helps us build bone as we age, not break it down with osteoporosis. And then growth. So again, growth in the size of our cells and growth in the individual. Those are all characteristics of life that are necessary for life to occur. So again, be able to just give examples of each of those to show that you understand what those terms mean as it relates to life. So I have lots of examples here if you want to look, you know, at those. But the list is something that you'll see a couple of questions from on our test. So survival needs. Now this is something that we need on a minute-to-minute basis. Like, I don't need to grow right now, right? Or I don't need to reproduce right now, you know. So think of that as more long-term, but this is survival in terms of right now. If you take this away, you know, a person can die very quickly. So nutrients, if we don't have any nutrients, we're not going to last very long, right? So we need nutrients. Oxygen, we can only last for about 5 minutes without oxygen. Water, what is it, the 3 rule? Have you heard the three rule? 3 weeks, what is it? 3 weeks without shelter, 3 days without food. No, 3 days without water. There's a 3. Anybody know that rule? I got it from a farmer. There's a shelter. Maybe it's 3 months. I don't know. It was a rule of 3s.
Days without water, 3 hours without shelter, 3 minutes without air.
Oh, is that what it is?
That's what I got.
Okay, okay. Yeah, that works. Yeah, okay. Well, anyway, we need oxygen. With the help of hemoglobin, we can make it for about 5 minutes before brain cells and body cells start to die. We know we need water. If you're totally dehydrated, you will pass out and be lethargic and unable to function. Normal body temperature, we know that. If it's too high, we'll have seizures. If it's too low, we'll fall asleep and slowly die. So we need that. And atmospheric pressure. We need that. If they don't pressurize the cabin when you're at so many thousand feet above the Earth's surface, you know, you'll die very quickly. So we need those specific things to survive on a minute-to-minute basis. So think of it like short-term when we're talking about survival needs versus characteristics of life. Okay, so we have this term that we talk about in anatomy and physiology called homeostasis. Homo means same, stasis means stationary, but the key word here that I've underlined is dynamic. If someone has a dynamic personality, it means they're really outgoing and they're just kind of all over the place in a good way, you know, changing, not just boring and flat. So dynamic state of equilibrium means we have like a blood pressure that is about 120/80. When we're running up the stairs, maybe it's 130. We step on a sharp object and we're in pain for a couple of minutes, then it might go up a little higher. Then we're sleeping and it's going lower. We're watching TV, it's a little lower. So it's all normal, but it's changing. So that's what dynamic means. So, and it's within limits, so narrow limits. So we don't want blood pressure to be up in the 180s, and systolic, the top number. We don't want that in the 180s, and we also don't want it in the 70s either. So there's narrow limits of what we consider normal. And that's, as healthcare workers in the future, for some of you, you're going to be looking at those numbers, and you have to know what those numbers are and some things that affect those numbers. So if I'm giving a blood pressure pill and I take my patient's blood pressure and the pulse is 50 and the top number is 82, do I want to give them that blood pressure pill? No, because I'm going to tank them even further, and I might kill them by giving them that blood pressure medicine. And that happens in the hospital. People are sick. They're getting different medicines. Sometimes we overdo it, and we have to really pay attention. And that's the importance of knowing your anatomy and physiology. Because I, as a nurse, I'm not a float nurse, but I'm an on-call nurse that can pick up shifts on other floors if I want. There's like a needs list that we pull off of. And I've gone to other floors, and I've gotten report from nurses that they sound like, wow, they're really smart. They really got their stuff. This is a good nurse. And then I go to the patient and get in the chart, and I realize that that nurse had no clue of what was going on with this patient and had actually done some inappropriate things on their shift that were taking the patient further from recovery. So that's where the A&P knowledge comes in. And some people say, oh, I just need to get a C in this class. I don't even care. Who cares if I know this? I just need to get a C. That's not true. The good nurses know their physiology, and they know how that affects their patients. And it's not going to be that you're going to be an expert at the end of this semester, but it builds on itself. And if you're building a good foundation by paying attention now, you're going to do that much better when you get to the next level. But if you're one of those, I just want to get by, then we don't want to see you at the bedside of a patient that's starting to crash, because you're going to miss it. And are you going to get in trouble for missing a patient that's crashing? No, because patients are sick, right? You say, well, grandma was 80, her kidneys failed, you know, she was 80. But guess what? Grandma was showing signs of kidney failure that the nurse didn't catch, that we could have prevented, and grandma could have gone home and lived another 6 months and made it through Christmas and all that. But grandma didn't because some people dropped the ball. So it's really important that you know your A&P and you pay attention and be the best healthcare worker you can be, so you don't go home at night realizing, oh, shoot, I probably should have done that differently. I wish I would have known that. So it helps to pay attention to that stuff. So 4 components of a feedback system, which is what our body is constantly doing, is looking at a variable. And the variable might be blood sugar levels, carbon dioxide, oxygen levels, pH, carbonic acid. We have some waste products that we're going to talk about, you know, sodium, potassium levels, you know, your temperature, volume of fluid and blood pressure. All those things are variables. And then you have a control mechanism that works to adjust those variables. So we have, looking back at this here, we have sensors. And their job is just to detect a change in the variable and send it to the boss, which is the integrator, to change it if necessary. For example, if body temperature is dropping and you're getting cold, what's going to detect that? Yeah, your skin. You have temperature receptors that are part of your nervous system that are in your skin that are detecting a temperature drop. And it sends that information to your brain, and there's different parts of the brain that control different things. A lot of times it's the hypothalamus. And the hypothalamus will say, oh, this body temperature is too slow or is too low, so it's going to kick in the people that'll fix it, the cells that'll fix the temperature problem. So what do you think the effector cells are when you're getting really cold? Yeah, your muscle cells, which shiver, and that rhythmic muscular contraction raises body temperature and keeps you going for a certain period of time. Hopefully it fixes that, and then you feel better, or you use your higher level cerebral cortex and you put a sweater on, right? Or you turn the temperature up, or you go inside. So there's this constant loop, so it's continuous. We're constantly sampling with our sensors. The integrator is deciding if something needs to be done, and then the effector fixes it. So think of effector fixes. So there's the F word in there, and the effector fixes. And the sensor senses. And the integrator is the boss, deciding, do we need to fix this or not? So nervous and endocrine systems are the most common components of a feedback system. They're always fixing things without our conscious knowledge, so we don't have to worry about those variables because it's under control. And most of our feedback mechanisms are negative, which means if something's going up, the body kicks in and brings it back down again. So negative is a good thing, not like in your checkbook, right? Negative is good. It means it's like a teeter-totter. Blood pressure is going up, the body kicks in, opens up the blood vessels to drop the pressure, pressure goes down. So it's stabilizing. That's the key thing. You should highlight and underline these two terms. They're the most common, and they're stabilizing because it brings us back to normal within those variable limits. So body temperature we talked about, nerve receptors in the skin would be the sensor, the brain is the integrator, and the muscles that cause shivering would be the effector cells. So be able to give an example of negative feedback, because those are important mechanisms you're going to see in your patients. And I can tell you it's the #1 cause of why patients come in the hospital is they have broken feedback mechanisms. Their heart isn't able to adapt, or their blood vessels can't open up to drop blood pressure because they're full of cholesterol and plaque. So we have to give medicines to do it rather than allow the body to do it on its own. And the other type of feedback is positive feedback. It's less common, and it's not a teeter-totter effect. It pushes things in the same direction, like childbirth. If we have pitocin or oxytocin causing contraction of the uterus, that's going to cause more contractions, more oxytocin release to get the baby out of the birth canal. So we're constantly pushing something in the body in the same direction to accomplish a task. So it's not stabilizing, it's keep pushing to get that baby out of there. So keep contracting the uterus with the help of this hormone until we've gotten the baby out. Keep secreting milk from the milk glands until baby is done nursing. So milk release causes oxytocin, which causes more milk release, which causes more oxytocin as baby suckles, again causing, allowing the baby to eat. Blood clotting, keep adding more platelets to the broken blood vessel until bleeding stops. So those are examples of positive. Be able to know the 3 specific examples of positive feedback, and everything else is negative. So that kind of helps. It's less common. So this is just an example of how that feedback mechanism kicks in. The pushing of the baby's head on the cervical canal causes oxytocin release, which causes contractions of the uterus, which causes more pushing, which causes more oxytocin release until baby's out. And the artificial version of oxytocin is pitocin, and we give that in the hospital.